Hello, doctors. I just want to share my feelings, my advices to all of you through this video. I have given many motivational videos to all the young doctors like you who wants to really understand the subject and really wants to do very well in this. So my advice to all of you is going to come through this video. I have made this video in Tamil and it have reached many people, and today in this video I just want to give a lot of things which are very important to you. Many of you young dentists, after you finish your college, actually your clock is starting that time only. So what is happening? Once you finish your college, the everything whatever you are planning to do in your life should be planned on the time. Many of you I have seen there, you are not valuing the time you have. For example, there are people who are keep on postponing their plans, like maybe next year I will take NEET exam, maybe next year I will go for my clinic, maybe next year, next and all that. You can delay all your plans for next year and things like that, but at one point of time in your life when you are earning nicely, say for example, if you are delaying your project for 2 years, in future when you go and earn some nice money in your clinic, what happens is you will regret. Suppose you are earning say 10 lakhs per month, you will regret, I wasted 1 year of my life by doing all this. I should have done this earlier. I should have started my clinic earlier. I would have earned one more, you would have earned at least 1 crore of rupees. That is the value of that. So the value of the time you are losing in your life will be actually calculated in the future. For example, when I finished my college, I immediately joined the job. So immediately before I came out of army, 2 months before I came, saw the place whichever I am practicing right now, I gave the money, I started the work and I went. When I came back, immediately I started practicing. So I didn't waste my time. So everything is happening very fast in my life. So people, I just want to advise you, don't waste your time. Okay, after college 100% you have to work with some doctors for 2 years. Why I am telling 2 years is because the first 1 year you may not be very serious, you will be just going and coming. But the second year you should, if you know that only 2 years you have to work, because if you work for 2 years you can go abroad and you can earn some money. Even abroad doctors, they are asking for 2 years clinical experience. Okay, whether you're going for a WARI exam, whether you're going for any other exams or a job or anything like that, you have to have 2 years of clinical experience. Go to a doctor where there are a lot of patients flow and work there and try to take good responsibilities from them, because many of you are still playful, still childish in the duty time, because you are relaxed, you are working in a very relaxed mind. Why I am telling this, always you should work with the sense of urgency. You should feel, oh my god, I am wasting my time, I have to do something. Because if you are not calculating the wasting of your time, you will regret all this in future. I am 100% telling you, because sometimes I see some assistant doctors, they are not very committed, they will be just coming and just going without having a goal. So what happens is they think they have a lot of time to play around. They will be very slow in their work, they will not pay attention to the activities of the clinic, rather they will be focusing on their own thought process. So what I advise is, if you know that only 2 years you have to learn everything, you have to learn implants, you have to learn RCT, everything, you have to work very fast. Always when we look at time, it look as if we have a lot of time, as if we have a lot of time to do everything. But when you see your life, always you will find less time only, because whatever you are calculating, definitely you will be running short of time. So please don't waste your time. Immediately after the college, please go for clinical experience, please go for senior internship, please go for some courses. Okay, I want to give some piece of advices for male doctors and lady doctors separately, because most of in Indian context, in the society, most of the parents are looking to get you married very soon, because it is a big responsibility for them. So I am seeing lot of lady doctors. Suppose you are a very ambitious lady doctor, you want to settle down immediately in the college itself, study nicely and clear the NEET exam, go to the government college. Because what happens is, I am one of my in one of my clinical doctors assistants, my assistant doctors parents, they came and they felt very bad. They were telling me that my daughter may not agree for a marriage, or may not agree for going to the next level. So what happened was, I really felt the mindset of both the doctor and the parent. Parent is also correct, the doctor is also correct. The doctor is ambitious, she wants to pursue her post graduation and she wants to do a better job in the dentistry. But parents are thinking, we have already given enough time, now her age is coming off, she is becoming like 27, 28. We want to get the daughter married. Is it wrong? So when I told them, see, it all depends on your kid's mentality, your child's mentality. Okay, she wanted to study, and you have to communicate with her and ask her what she really wants. So my piece of advice is, listen to your parents also, listen to your parents and hear it out, like what they are advising you, why they want to get you married and all that. They may be very old, the grandparents may be there, there may be some sentimental reasons behind all this, and you have to listen to it. It's a big responsibility. In a society like our India, we are very sensitive as a social values, family values comes first compared to the professional values. Okay, so what my advice would be, if you don't clear NEET exam and if you didn't prepare properly in the first time, obviously the next year it will fall into the next year. Every year will go off like this. So work really hard and try to enter the post graduation as early as possible. Either they say don't take the knife. If you take the knife, chop that thing into two pieces, whether it could be an enemy, it could be an object, or whatever reason you're taking the knife for. Likewise, don't write the exam. If you write the exam, please clear the exam. Otherwise, no, it's waste of time. So a lot of people are confused. What they do? After, immediately the parents will tell, you are not getting clinical experience, you have written the NEET exam for the first time and you're not cleared, why don't you go for a clinic? Here comes the problem. Instead of working really hard on the NEET exam preparation, they will start going to clinic, and in the clinic also their mind will be fully focused on NEET preparation only, because a clinic, it's a different game, because you cannot have the mindset for NEET preparation and work in a clinic. They say you should not work for 2 masters. It's going to be very, very difficult. Having clinical practice and having preparation and all is not going to be that easy. It's going to be very, 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 very challenging. If you are studying, there are a lot of things you need to go through. You have to do revision, you have to do a lot of tests, you have to attend classes. That itself will take a lot of time. Okay, this is where the problem comes. So you'll start go to clinic, then the new problems will come. When you go to a clinic in your own place, it is okay, but when you come to a city place, you have to stay alone. The food problems will come, health problems will come. There are a lot of things which I'm sharing in this video. These are all happening in my clinic in real time, so I'm sharing. So you feel homesick, then you want to go home and come. So much of time you are getting wasted. Vice versa, in the patient side also, you are not going to be much dedicated like other doctors. You will be always thinking of your goal, and you will not put your 100% into convincing or learning and doing. It takes a considerable time before you become ambidextrous in your work, which means like very convenient in handling the patient, sitting them, you sit with them and you do some treatment and all that. It takes time. You have to understand, everything takes time, at least. Okay, but you have lot of pressures, especially women dentists have lot of pressures from the family to get married. Suppose you got married, the decision making becomes even more complex. You have to share your feelings to your husband, and husband has to agree, and there are so many things. The children are there, it's even more tougher. Who will take care of the kid, my father or your father, my mother, your mother. So much of confusion. So earlier in your life itself, you have to plan. Just after the internship, quickly go and join a job, or quickly study nicely, and don't waste your time. That is why I'm telling, please don't waste your time. Okay, these are the important things. Okay, what will happen, suppose if that lady gets married and if she is going and settling down, then the thing is not in our hands. The lady gets the doctor gets pregnant, and she'll go into the family way. Things will be, the priorities will be totally different. Health issues will come, there are so many other things will come. So the focus completely shifts, and we have buried all our dreams, ambitions, and desires, when you retrospectively think, you'll really feel bad. What happened to my dream? What happened to my desires? What happened to my dream of doing an MDS? What will happen to my future? You will be worried, you'll be feeling guilty about your past, and you'll be also feeling very insecure about your future. All these emotions will put your confidence down. You won't be very involved in your family life also, because inside you are bubbling with lot of disappointments and lot of ailments and lot of feelings, and outside you will be happy for some time, but really this thing will be really haunting you. Again, I'm telling you, this is purely waste of time, because of the time you have wasted in your internship, the time you have wasted in your initial days of practice is going to come behind you and going to haunt you. I'm telling you. Okay, what should you do next? Suppose your life goes on, and at one point of time you will really feel that you have come far away from your goal, and where to go and restart my career, where to start. Now I am very old, I am almost 30 or almost 35, I have kids. What happened to my clinic? Where should I go? Okay, please communicate with your husband from day one. Even before you get married, you please get him to your place or your clinic and show him how, because if he is not a dentist, it's going to be even more tougher, because a non-dental person may not understand the problems of a dentist or a dental profession. You have to explain how difficult is this profession, how good is this profession, how much you can earn through this profession. All this have to be communicated, because this kind of communication, it's going to be very, 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 very important for your spouse to understand you. I'm still talking to the lady dentist. I'm going to talk to the male dentist also. People always think husband is earning well, why you have to go and earn? They will bring everything in terms of money. They won't even understand your feeling of treating a patient and feeling satisfied and all that, unless you're so super ambitious woman who don't bother about all that, and you say, no, career is my everything, that the family is my second priority and all that. Such person means it's different. But I am talking about the other people who are very, very confused or not able to decide and all that. This video is going to be helpful. So again, where to start again? Now you are far away from your clinical practice. Okay, again everything is out of touch. I don't know how to give LA. There are some women, they call and say, sir, it's been a long time ever since I've come out of college, and now I've totally forgot everything. I don't know how to give a LA also, sir. I'm totally lagging confidence. Totally, I don't know what to do. Totally, I am clueless. I am helpless. And they literally cry in the phone. I just want to tell you, don't lose hope. You are delayed. That's all. And still things are in your hands. Start going to some course, attend few things. And I have seen superb, like lot of women, they start late, the small clinic, they start setting up their clinic even at the later age, and they pick up very well. So don't worry, don't give up. That's the thing. So ultimately your mindset is very, 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 very important. Everything depends on your mindset and your personality. Okay, now I am going to talk to the men part, male doctors. Okay, male doctors, I just want to tell you, okay, right from, I have seen students, especially from first year to final year, there are certain boys who are very ambitious, like they are very ambitious in their life, early in their life, like around 11th, 12th, they are very focused, they come to college. I have seen people, they'll be very studious in school. When they come to college, they start seeing the freedom and the liberty being given in the colleges. They start taking things very lightly, and slowly they deteriorate in their career path. That's why I've seen some people who have got merit seats in government dental colleges for BDS will flunk in their BDS, and they flunk in their MDS NEET also. Some people are stable from 12th standard till the college, till post graduation, till they get into a government job or something, they'll be very stable. But there are some people, they will go up like this in life. Instead of going up again, they come down below, they flunk, and they ruin their life. So why this is happening is because of overconfidence. Okay, just because you got a very nice mark in your +2 exam and got a government seat or anything in any college also, your parents would have spent a lot of money, and they would have done this BDS course for you, and now things are in your hands. You're not taking it lightly. Padana first year vandirukkom, abhi to first year aaya let me see till 4 more years to go. It's not the first year, second year, third year. you have entered into a medical profession. Medical profession needs a lot of dedication. From day one you have to be very good in, you enjoy life, I'm not denying it, but you have to be, when you come in the study spot, you have to be good, you have to finish the classes, you have to go to classes correctly. A lot of men, the boys, they don't do this, they don't go to classes regularly, or even if they go to class, they don't pay attention to the professor's class teaching, they just pay attention to something else, they play with the phone and all that. Don't do all that. When you are doing work, be sincere. When you are enjoying, be sincere in enjoying. Okay, this is my piece of advice to those boys who are in the first year. Okay, those boys who are in the second year, so the common advice I just want to give to both male and female dentists, especially students, is this is a subject with lot of hand work and also brain work. For medicine, you don't have to be excellent in your hand. Hand is whatever you do with your hand. Okay, you can be a basic, an average person, and you can still manage. Whereas dentistry, every day, the more you keep doing dentistry, your hands become very nice. Even a good dentist, when you do a massage, like you just press the massage, do some massage for somebody, they will feel nice because your fingers are so so sensitive, and you could feel, you can do a lot of manipulation with your hands, because your hands, we have good sensation, tactile sensation when we do RCT, when we do extraction, we use lot of physics through the wrist, through the elbows. Our hands are very, very important, especially for dentists, because without hands we cannot practice dentistry. So what happens is, one side we have to have intellectual knowledge. Intellectual knowledge is very, very important when you are studying. You don't study as a dentist, study with curiosity. Study with curiosity. The common advice I wanted to give actually is, lot of male and female doctors both, you all are thinking only one thing: I should have gone to MBBS, I didn't get MBBS, I just missed MBBS by a few marks, I just missed a government college, I cannot afford a private medical college, so my fate, my destiny. The problem with this mindset is, you have not accepted your destiny. Your destiny, you are born for becoming a dentist. You are born to be a dentist, man. Why are you fighting that? God has made you born to your parents to become a dentist. Okay, I thought like that. Nama perandade pal doctor avradhukda. I cannot think of becoming anybody else other than a dentist. That's how I accepted this. Everyone wanted to become an MBBS. Doctor means an MBBS doctor only. But why are you still fighting, man, in your mind? There is something called amor fati. Amor fati is a Stoic principle which says that you have to accept the fate. When you start accepting the fate, you will feel life is so beautiful and pleasant. Okay, like some people are still fighting with their spouse. Why I married to this man? Why I married to this woman? Why this kind of child is born to me? They still didn't accept that. They're still fighting with that person or the situation. Accept your fate and just move on. That is very good. That mindset should be very, very important for dentists, because if you keep on regretting the life's choices, because you might be feeling that life is not fair. You have worked so hard, life is not fair, God is not fair, destiny is not fair. Please don't have that mindset. Please never have that. Enjoy what you do. Okay, accept it. If you accept it, you will start enjoying it. That is why they told you to do, the syllabus of dentistry is structured in such a way, they are giving importance to both the handwork and also knowledge work. That's why you go to medical colleges in the morning for learning anatomy, physiology. In the afternoon, you go to the dental side, plaster, block making and all that. So this is the secret which they didn't tell us why they are doing this. But the thing is, they know you need knowledge and you need hand skills also. It takes some time. That's why day one in the first year itself, they tell us to do lot of things like doing plaster work, doing wax carving and all that. All these skills are going to be very, very useful to you. Enjoy it, man. Enjoy it, because when you do a feeling, the skills you learned in your third year in your typhodont, that is very helpful. In the mannequin, you learn something to make a cavity and show it to your professor or tutor. That is going to be helpful when you do a patient work. So these are the foundational things which I am talking. The foundation of any successful dentist is enjoying what the dentistry is all about. I have seen dentists who are superb, who are brilliant dentists. They have the one thing, the common line which connects all the dentists is not their knowledge or degree, or it's the enjoyment, it's the acceptance of being proud of a dentist and being proud. People, they stand in the national podium and talk to big crowds, put their presentations. Such doctors, they love what they are doing. They love dentistry, they love the way they enjoy the subject, and they make a ton of money. If you love this subject will provide you a ton of money. You won't believe how much you can earn with this subject, because this scope is so good in dentistry. The scope of dentistry is so good. You can do implants, full mouth, there are so many things you can do. You can do orthodontics, so much of potential is there if you know how to deliver the results to the patient. If you know the subject, if you know the technique, you can do. But all this still takes some time. That's why I'm telling time. Time is the word. You have to take it in your head. Time. Don't waste your time. Go to course and learn some subject. Go to some institution and learn a short course. Even if you are a practitioner who are watching this video, please don't waste your time. Don't think the skill you learned in 2003 is enough. No, go to a course which will update you, which will give you more points, which will give you some more positivity when you attend a course. So please understand, you have to value your time. People, as you are coming towards your third year and final year, I am telling you, the third year subjects like general medicine, general medicine, general surgery, they are very, very important for you, because once you finish your college, when you want to apply for UAE, Gulf countries, or want to go to UK or Australia or any other country, medical knowledge, they consider it very important. How to handle emergencies, how to handle anaphylaxis, how to handle the protocols for prescribing medication, everything. Like UK, if you take, I'm writing my MFDS exam too. As you are seeing this video, I'm preparing for it. I can understand the easiness for me to go through all that, because I was the best student in medicine and surgery. So it really helps me, what drugs to be given for anaphylaxis, all written guidelines, everything is there. Okay, so dear friends, you have to understand third year and final year is also very, very important, especially third year, this subject. Final year, you are focusing fully on clinical dentistry, fractures, there are so many, all this 8 subjects we have, they're all very important. Clinical subjects like your restorative dentistry is very important, composites are very important, endodontics is very important, pedodontics are very important, because when you handle a kid, you should know what is the psychology you should follow, how to handle the kid will be coming and crying, you should know what is tell, show, do technique, you should know what is modeling technique and all that. When you extract the teeth, if you break a tooth, you should know how to remove it. You should know the theory at least, man. You should know what is whether you should use an elevator or whether you should use an elevator or a forceps. You should be able to make out the difference. My dear friends, the mindset you should need to develop is, please get involved into the subject, put your 100% in it, and really I'm telling you, this field is such a good field. I have made many videos in dentistry. There are lots and lots of people who put messages in Instagram, Facebook and WhatsApp. They say, sir, I'm very motivated after watching your video. At least one soul your mind should open up after watching this video. Yes, there is good scope, man. There is good scope. There are crores of money you can earn to this profession. What is lacking in this profession? There is nothing, man. There is nothing, doctor. There is nothing you are lacking. Every enjoyment, you can use technology, artificial intelligence, that is there in intraoral scanners and softwares. The 3D printing technology, yes, it is there. Anything you tell, it is there. There are a lot of apps you can use. There are a lot of softwares. If you are a very digital tech savvy person, you think I would have become an engineer in IIT and all that, you have tons of research you can do in our subject also. There are biochemistry, biomechanics, there are so many things you can do if you are a very, very scholarly person. Okay, average person like me, we enjoy clinical dentistry. We want to alleviate the pain of the patient. We want to help them by restoring good smiles, by restoring them confidence, by restoring them happiness, peace of mind, joyful life. I really love dentistry. And if you at all you have watched this video fully, I think this last 15-20 minutes of motivational talk for all the cadres of our dental profession, first year, second year, third year, final year, both the boys and the girls and everything. I'm very, very glad. Please show this video to your parents also. Suppose some parents are not happy with your subject. Please, parents, if you're watching this, I want your valuable comments. I have not prepared anything for this video. Whatever is coming in my mind, I just want to share with you. Don't waste your time. My dear friends, please don't waste your time. Go to some clinical skill, learn it, and keep updating your knowledge. We have to be updated. We have to be involved. You have to be very passionate in your subject. I am very passionate. I am very involved. I am studying all the time. It helps me to keep up in my profession. It helps me to stay above everyone in this profession. It helps me to be the number one in the profession. And I want all of you to do the same whenever you're watching this video. If you are inspired by this video, what points have inspired you, please put it in the comments column. What point have touched you and what is the transformation this video has given to you? I just want all of you to put your valuable comments so that this video is being shared to many dentists and their life will change, and this one video can change your life, and I strongly believe it. I pray for you that your dreams and desires you will achieve, your life's happiness you will achieve. I've given so much of advices, so much of knowledge in this video. I hope this video would have definitely touched you. Whomsoever you have seen this video, please put just one of your comment. I want one comment in this video how it touched you. I'll be so glad to see each and every comment, and I'm going to thank all of you for the comments you're going to put. If you want to talk to me personally, please use the number below and call me and ask me for any guidance, any counseling about this subject. I can guide you correctly. Thank you, dear friends. Thank you for your support to our YouTube channel. Please click the subscribe button and the like button so that you get the notifications also very regularly. And thank you and God bless you.